Changing Healthcare, an exploration of people and brands that are disrupting healthcare for the better. And I'm so excited to be sitting here today with Wendell Potter. Wendell is a best-selling author and public relations executive who spent more than 2 decades in the health insurance industry when he quit his job and became one of the industry's most outspoken critics. Since then, he's written 3 books that all turn the spotlight on how some of these health insurers and their policies are deceiving and even killing Americans. And as I understand it, he's also a staunch advocate for Medicare for all, which makes him a personal hero of mine. And today we're going to talk a little bit about a topic that I've been wanting to get to for quite some time, and that is, why is it that so many health insurance companies do not cover natural medicine? So, Wendell, thank you so much for sitting with us today.
No, my pleasure. Thank you, Patrick.
Yeah, my pleasure. So, can you have an amazing story. Can you tell us a little bit about your journey from, the VP of corporate communications for Cigna and then becoming one of the most vocal critics of the industry?
Well, yeah, I spent 20 years in the industry, first with Humana and then with Cigna. Was at Cigna for almost 15 years, and I left after a crisis of conscience that began to develop several months before I left. And largely as a consequence, or at least began during a trip back home to Tennessee where I grew up. I have lived in Philadelphia for quite a long time. Cigna relocated me here many years ago. But I grew up in East Tennessee, a very poor, fairly remote part of the country. And I just flew back to visit family. And while I was there, I read in my hometown newspaper about something called a healthcare expedition that was being held pretty close by at a county fairgrounds. And the story said that people were likely to drive from hundreds of miles away. And in many cases, they would sleep in their cars overnight just to get a chance to get inside the fairground gates to get the care that they needed. The demand was that much, and they could only accommodate so many people in a given day. And this was over a 3-day long weekend. I was curious. I borrowed my dad's car and drove up there and saw something that I just could not imagine that that could have been possible in the United States. I saw people who were lined up. The lines stretched completely out of sight, and in many cases they were soaking wet because it had rained just before I got there. And I noticed that a lot of those lines led to barns and animal stalls. This was the county fairgrounds, and I was just absolutely stunned. I had been able to lead a pretty comfortable life as a corporate executive, and was not even aware of that organization, even though that particular event is an annual event that at that time had been going on for 9 years. I knew immediately when I saw that I had to take some responsibility for it, because my job was, in many regards, my major objective was to perpetuate our current healthcare system, to reward shareholders, because the companies I worked for were for-profit health insurance companies. And I also knew that if I hadn't been lucky, I could have been one of those people. A lot of the folks that I grew up with, I was the first person in my family to go to college. And I realized that some of those people on those lines could have been people I grew up with. Could have been neighbors, former neighbors, could have been relatives. It was a true awakening, an epiphany for me. And I also had been a reporter in my first career. And I also came to realize on the spot that what I was doing for a living was in many ways the exact opposite of what I used to do for a living as a reporter. I never tried knowingly to mislead people, to say or write anything that was not accurate to the best of my knowledge. And I had to accept the truth that in my career in the insurance business, that was exactly what I was being paid to do, was to mislead people in many cases, to often tell half-truths, which in many cases can be even more damaging than an outright lie. So I made a decision that I would have to figure out some other way to earn a living. It became a really true crisis of conscience. I couldn't get that out of my head, and I ultimately walked away.
That's so remarkable. It just makes me wonder, like, there's so many stories out there. I mean, it's such a part of our national conscience what a mess our healthcare system is right now. Um, there's got to be other people in the industry that feel like you do. Is it just that they're so insulated, like they didn't take the time to witness events like the one you went to and really expose themselves to that sort of naked truth?
Often it takes something like that to prompt someone to really do a self-assessment. And uh, uh, someone did an article about me a few days ago and mentioned a book that had been written a few years ago. It was called U-Turn. And it was by this researcher who said that there are, a few people who encounter something that is uh, so life-changing that some people do make, as he put it, a U-turn in their lives and their careers. And that's what happened to me. It doesn't happen to a lot of people, apparently. You're right. There are a lot of people in the insurance industry who also know that it's not a good system. On the other hand, the job that I had gave me some insights into how my company and the industry really works in ways that most people, even within these companies, don't get a chance to see. And they don't do the kind of work that I was doing. They're not necessarily people who are engaged in propaganda or work with the investor relations department and the CFO and the CEO. I had a job that was near the top of the company that gave me insights into what really motivates the top executives. And I also worked with my counterparts at other companies with our trade association to create, we call them strategic communications plans, but they were really campaigns based on fear, uncertainty, and doubt to get people to be afraid of change that we all need.
Yeah, and that confirms what so many people really suspect about what goes on there. And I think that that's really what makes your perspective so incredibly powerful, is that you've been on the inside of this, and you really know how the system works from within, and how it sustains this sort of situation where people are just paying out the nose for health insurance and getting very little affordable care in return for it. Yeah, it's just amazing to me. And I think this is a good segue into, the fact that there's very limited coverage out there for so-called alternative care services like functional medicine, acupuncture, chiropractic care. In fact, in many small to medium-sized businesses and the plans they offer, it's non-existent, right?
Mhm.
But in the meantime, demand for functional medicine services has gone up and up and up over the years. So, as somebody who's been on the inside, can you share a little bit about what's the conversation happening inside about natural medicine with health insurers?
Well, it's not something that is discussed as much as it should be. Um, uh, Often, it takes years before something comes to become a covered benefit. I remember when I first joined the insurance business or began working, I don't think even chiropractic care was covered under many, if any, benefit plans that my companies offered. So it takes time. There's more conversation, to be honest with you, about how can you meet shareholders' profit expectations? How can you avoid paying claims? How can you manage medical care, which means how can you manage medical expenses in ways that enables the company to maximize profits? So those are the kinds of conversations that really go on. I don't recall uh, uh, ever being in a meeting during at least the last 10 years of my career in which there was a real conversation of any kind about what is in the best interest of the health plan member. It is all about what is in the best interest of the shareholder. And in many cases, I mean, in fact, in all cases, the top executives are also shareholders. So they have a financial vested interest in maximizing profits too, because the more money the company is able to convert into profits, the more they benefit as well too. So there's just not much conversation, period, about it.
Yeah, that makes sense. I mean, people think of it almost in the same way as like auto insurance, right? You're trying to minimize risk. You're paying into a system and getting rewards for it. But really, the people who assume that health insurers have the best of intentions are really thinking about the long-term interest is really just about providing the best care possible for people, even if it is expensive. Whereas people aren't assuming that the real conversation is about how to maximize profitability for shareholders, but I suppose maybe I'm just naive.
Well, the problem is that health insurance companies have increasingly become for-profit corporations. And it wasn't when I was growing up. Most of the health insurance companies originally were, in fact, all of them originally were operating on a nonprofit basis. It's only been the last several decades that most of them were increasingly, they have become for-profit businesses that have this slavish devotion to the shareholder. So that's been something that has worked against the best interest of the rest of us. And again, uh, I think maybe back in the day, in insurance companies that were nonprofit, they were not actually getting between a doctor and his or her patient or a clinician or practitioner. Um, but that's changed, and all too often, the way to maximize profits is to erect barriers to care.
Hmm. Yeah, that makes sense. I mean, with conventional medicine, on the one hand, it's sort of widely accepted that really just they're focused on managing diseases,
Exactly.
prescribing pharmaceuticals, addressing, acute problems that people have, whereas functional medicine is much more about attacking the root cause, which is usually related to a hormonal imbalance or maybe the gut or something related that sort of creates a domino effect with these problems that people experience within their metabolic systems. And you'd think that as time has gone on and more data is accumulated, that health insurers would be eager to embrace an approach to medicine that does have long-term benefits, but that just doesn't seem to be the case here.
It is not the case. Uh, the the Someone has said, it wasn't me who said this originally, but we don't really have a healthcare system in this country. We have a disease management industry. And from the perspective of a lot of healthcare providers, certainly most pharmaceutical companies, they're not all that keen on getting you well. They would love for you to be on maintenance medications for the rest of your life. That's how they make money. Uh, and there's very little research into anything that's an alternative to that kind of profit making. So you have that going on. You have other things that are a factor as well too. One is, keep in mind, insurance companies aren't that interested, to be honest with you, in saving money. Uh, they don't want to pay claims, but they don't necessarily care all that much that healthcare costs continue to go up. And they don't care that much either about devoting a lot of resources or time and attention to getting people healthy, keeping them from getting sick in the first place, because there's a lot of churn in the insurance business. You might be an Aetna member today and a Cigna member next month. So there is a lot of churn, and insurance companies don't think it's in their financial interest to devote a lot of time and resources on individual health plan members because they're likely are not going to be there for the duration.
Right. Yep. I've done some other research on this topic, and there's a great article that Envita published on this subject not too long ago, and they point to several sort of barriers that exist in the broader picture here. One of the things that they mention is that health insurers point to the lack of research that's in place that they use to determine the necessity of alternative care and how that would really apply with conventional models and so on, so that they can determine, how that care would be applied, how they would manage costs, et cetera. But at the same time, they're also kind of writing the rules themselves about what's permissible and what's not. Do you have any thoughts on that?
Well, it's true. They do. Um, you've heard the term evidence-based medicine. That's a term that's had a lot of circulation within the industry for many, many years. Um, they are not keen on covering anything that is not based on research that's been published in some peer-reviewed journal. The other thing, too, though, is that insurers, frankly, more often than not, follow the lead of the Medicare program. It's not immediate after Medicare agrees to cover something that private insurance companies will begin to do that. But there's usually a pretty short time frame. If Medicare begins to cover something, insurance companies pretty soon will also. And then, of course, for medications and things like that, they will say that it's important for them to protect their members from any adverse events, and so they look to FDA approval before covering anything. That's not FDA approval is not an automatic that just something that is FDA approved will be covered, but they often will say, well, something's not FDA approved, so consequently we're not gonna cover it.
Yeah, and that's a whole other can of worms with, pertaining to supplement companies and the
Mhm.
claims that their products can make and so on.
Yeah. Yep.
Yeah. So it just seems like there's a real quagmire in terms of like, you know, getting more people access to this approach to medicine that people are increasingly embracing.
Yeah.
And, what sort of gave me faith in it pretty early on was that, it's not just about, you know, taking more pills, even if they're vitamins. It's really about participating in your overall health, in being more active, doing the lifestyle changes that really impact your health goals, and taking supplements or other nutrients as needed. It just seems like a much more common sense approach to care. But yet there are some insurers out there that are sort of dabbling in this. Right here in Vermont, some natural medicine services are covered, but in other states, it's a non-starter. So, like, based on what you've told me already, why is it that some companies are sort of sticking their toe in the water in terms of functional medicine, whereas others are completely hands off?
Part of the problem is because we do have such a patchwork, and we have so many different companies, and they all have their very different practices, their rules and regulations. Their own list of what they will cover, and it varies. And also, even within a good or service that is approved, that doesn't necessarily mean that you're going to get it, because among the barriers that insurance companies have erected over the years is something called prior authorization. You can have something that is a covered benefit, but if a medical director at an insurance company says, "Nah, I don't think that's in the best interest of that patient," or for that patient it might be experimental or inappropriate, they've got enormous power. So you've got that going on as well too. But it's these are very subjective decisions, and some companies will be more lenient or embrace things that others will not. Also, there just probably are there are thousands of permutations of health plans. Most of us in this country get our coverage if we have private insurance through an employer, and often it is the employer that makes the ultimate decision. In fact, it is because for large employers that offer coverage, they actually are the insurer. We can get in the weeds on how that works, but often it is a decision made by an employer that contracts with an insurance company to manage benefits. So with all of that, there is wide variations across the country in insurance plans. Another factor, though, is where you live. If you are living in a state like Vermont, there is probably a greater chance that a health plan might cover things that, say, health plans in Tennessee would not, just because of the way people are and think in different places. But also, legislators can play a role. Insurance companies hate state mandates, but that happens all the time. Lawmakers in a given state can require insurance companies that operate in the state to cover certain things. And that obviously varies from state to state. There's no consistency. There could be some state mandates in Vermont that you don't see in other states. So it's just a real patchwork. And the problem with that is that you have no control over it. We're pretty powerless in terms of influencing a health plan or an employer. Not completely, and that's something we can talk about, but it's just kind of the way it is right now.
Right. So do you believe that the real core of the issue is just that health insurers haven't figured out a way to make a lot of money from the industry? Whereas all these studies and pharmaceutical companies can obviously afford the astronomical costs of this research in order to just get a seat at the table, right? Whereas that's unlikely to ever happen in an industry that's mainly financed through small practitioners.
That's true. In the insurance business, not just the insurance business, but it is a business. It is in the business to make money. And I've often said the one thing they know how to do is make money, and they do. But I can't tell you how many times during my career when I would hear about something being proposed that was new, someone would say, well, what's the business case for that? Have you done a business case, or has someone done a business case? And what that truly means is, has anyone worked the numbers to see if what the return on investment would be if we did X, and is it going to be worth an investment of company resources into doing something, or if we go in that direction, will it enable us to maximize profits, or will it be a potential drain on profits? And there's often that caution that anything new is likely to be a drain on profits. And that's what makes it so challenging for even things with business cases to get through.
Hmm. So with so many barriers standing in the way of all this, and I think you nailed it a few minutes ago, it's easy to sort of feel powerless with all this. I mean, there's no way that functional medicine practitioners can really enforce change, and even patients for that matter, by playing by these rules, right? Because we would just have to change the game completely. So as somebody who sort of knows the inside of the industry, what needs to happen in order for this sort of change to occur?
Well, people who want that change to occur need to really be politically active and active advocating. They have to become advocates, political advocates, as well as advocates within a company, for example. You work for a company that provides health insurance and you have a policy through your employer. Make sure your employer knows what you would like, how you would like to see things change. Find like-minded people. Bottom line is, be a squeaky wheel. Be relentless in your advocacy. Reach out to state legislators and regulators. Reach out to your member of Congress. Reach out to anyone who might have some power and influence over the regulation of health insurance companies. But it really comes right down to advocacy, and some people can. It's important to do things as an individual. Very important to do things as a part of a group. So if this means something to you, if you want to advance the conversation and get to the point of some real change, figure out how your voice can be amplified. And often it is working within organizations, but also, like I said, you can write letters to the editor, you can write letters and make phone calls to lawmakers and regulators, and to your to the HR department at your employer.
It seems like healthcare practitioners and other businesses within the industry, lab testing companies, supplement companies, could also form associations and try to apply a little political pressure there. Maybe they just haven't gotten there yet in terms of organizing, but it seems like, that would be a pretty powerful step too.
Oh, it absolutely is, because the associations that represent business interest have inordinate influence in Washington and the state capitals. I mean, obviously there are these gigantic ones like pharma and the American Medical Association, American Hospital Association, America's Health Insurance Plans, which is the big trade group for health insurance companies. They almost print money and spend enormous amounts of money on lobbying and through campaign contributions and propaganda campaigns to get people to think certain ways. But the idea of an association is to bring together various entities. And, for pharma, it represents a lot of different pharmaceutical companies. And the AMA represents a lot of individual physicians. And there are groups that represent physician practices. So it is important to belong to, and to support financially and in other ways associations of like-minded people.
What about Medicare for all? You're a big supporter of that. How do you see a new system? I know that we're still probably a long ways away from this, but and I would love to hear your perspective on that. But do you see a greater adoption of functional medicine services within a national healthcare system under Medicare for all?
I do. And I think it might be useful too to look abroad to see what the experience is in other countries that have publicly financed healthcare. There's a possibility that I always encourage that. Let's look to see what other countries have done that makes sense, that we might want to emulate. What I advocate for is an improved Medicare program, that we would expand that improved Medicare program to cover everybody, because even the current Medicare program has a lot of shortcomings. It doesn't cover a lot of things, not only what we're talking about. It doesn't cover dental, it doesn't cover long-term care or hearing. So there are things that need to be addressed, and for those things to be addressed and for change to happen, you need to have advocates who are pushing for it and have a real voice. I think under Medicare for all, you certainly could save a ton of money in this country. We spend about 30% of our total spend on administrative costs and profits and things like that are just completely unknown in other parts of the world. So you could save a lot of money. There could be research that could be done by even a university or a government entity into some areas that are of interest. But research is important, but it doesn't necessarily have to be done. In fact, if it's done by other entities, it even has more credibility. But I do think if you have a system in which everyone is covered under a plan, there's not that variation that I've talked about, we'd be in a better place in many different respects.
Well, you'll get no argument from me on that, for sure. Wendell, these are really fantastic insights. Can you tell people about how to learn a little bit more about you and your work?
Follow me on Twitter. I am frequently on Twitter and do what's referred to as Twitter threads every now and then that kind of lay out more about what I know, what I've learned from my years in the industry. So go to look for me at Wendell Potter. I have a website where you can find some things that have been published about me or that I've written at wendellpotter.com. I also founded a nonprofit journalism organization called tarbell.org. I write for that. I serve as chair of the board. I don't run it, but I write for it. And I lead a couple of organizations that I'd like folks to check out. One is called Business Leaders for Healthcare Transformation, and that website is blhct.org. And then another one, which is a 501c4 that enables us to do a bit more political work, is called Medicare for All Now, and medicareforallnow.org. So various ways to check in and see what I'm up to. But do follow me on Twitter at Wendell Potter.
I bet you get some very lively debates on Twitter about this subject.
I do. The most recent one had over 11 million views, thousands of comments, and I think more than 80,000 retweets. But the commentary was pretty interesting. Some people don't cut me any slack, but I've been doing this for a long time, and those sticks and stones don't bother me too much.
Yeah. Nothing is more detestable to some people than an adversary with actual experience in the topic that they disagree with.
It's true.
Right.
It's true. Yeah.
Wendell, this is fantastic. I can't thank you enough for joining us today.
Oh, my pleasure. Thanks for what you're doing, and appreciate being invited.
You bet.
Changing Healthcare is a production of Creative Side Marketing. Are you struggling to get trackable ROI from your website content? Trying to boost the number of quality leads for your sales team and provide an amazing customer experience? At Creative Side Marketing, we work with healthcare brands who believe in what's possible and help them disrupt for the better. Let us help you grow using inbound marketing and customer experience solutions. Visit us at creativesidemarketing.com to learn more.